Thank you very much, Mr. President, and thank you for inviting me here tonight. The last time I spoke at the Oxford Union, we won the debate. That was about the freedom of the press. The previous time, the Oxford Union showed enormous prescience when in 1994 the Labour Party was debating changing Clause 4. It's the dawn of New Labour. The Oxford Union saw through it and supported the original Clause 4 by an overwhelming majority. That proves that a radical tradition is alive and well in this university. And I really don't want to upset my colleague John Redwood with his rather strange analogy of traffic lights and roundabouts. I wasn't quite sure where it was going except in a circular place. But in London, it's his great friend who hates egalitarianism with every pore of his body and supports inequality with every fibre of his being, Boris Johnson, who is actually bringing in traffic lights rather than roundabouts. Maybe you could have a word with him if you get membership of the Bullingdon Club. I'm sure they'd have you now. At last. They obviously missed a chance with you earlier on. If I could just be slightly more serious for a moment. What do we owe to socialism in this country? Every single one of you in this room, at some point, has benefited from the principles of the National Health Service. Free at the point of use as a human right.
Well, I disagree with you on both points. It is not a human right and it is not free at the point of use. In fact, there is no such right in any sense that people ordinarily understand the meaning of the term. What the right to care means almost everywhere is nothing more than the opportunity to get services for free, or at very little cost as the government decides to make those services available. But government is under no obligation to provide any particular service. And if it fails to provide a service, people are not entitled to go to court and sue the way that Americans, for example, can sue an employer, a health maintenance organization, HMO, or even Medicaid. Now that was taken from the book Lives at Risk, and this is what it states about the NHS and how it is run. In order for healthcare not to cost so much, the government limits supply. They employ only so many doctors, they buy only so many MRI scanners, and they build only so many hospitals. The supply is always less than the demand, and in this way they always keep the cost down. You are paying at the point of service, but rather than paying with any physical currency, you are paying with your time. The magnitude of this can be seen by the following stats. In England, with a population of almost 60 million, government statistics show more than 1 million are waiting to be admitted to hospital at any one time. In Canada, with a population of more than 31 million, the independent Fraser Institute found that more than 876,584 are waiting for treatment of all types. In Norway, with a population of almost 4.5 million, 270,000 are waiting in queues on any given day for various types of medical treatments, including hospital admission. In New Zealand, with a population of about 3.6 million, the government reports the number of people on waiting lists for surgery and other treatments is more than 90,000. On the surface, the number of people waiting may seem small relative to the total population, ranging from 0.5% in Canada to around 2.5% in New Zealand. However, considering that only 16% of the population enters hospital each year in developed countries and that only a small percent requires serious and expensive procedures, these numbers are quite high. In New Zealand in 1997, more than 20,000 waited for a period of more than 2 years. In Britain, 43,900 patients, many of them needing hip or knee replacements, had been waiting for more than a year at the end of 2001. The London-based Adam Smith Institute estimates that people currently on the NHS waiting lists will collectively wait about 1 million years longer to receive treatment than doctors deem acceptable. It can also be seen when comparing the waiting times for different countries. Notice how the UK has the largest percentage for people who have to wait more than 4 months. Anyway, yes, it isn't free at the point of use as a human right whatsoever.
The free market capitalist economy of the United States has 40 million people without access to health care, and the rest have to pay a great deal for it.
Lies and deception, a powerful mind poison, to the university indoctrinated. But the American economy is not one of capitalism. It has regulations on it. where a capitalist economy doesn't. I would class it as a form of socialism where instead of controlling the means of production through central planning, it is controlled through regulation. Apart from this though, the United States doesn't have 40 million people without access to healthcare. The latest count shows that 43.6 million Americans, approximately 15.2% of the U.S. population, lack private healthcare insurance and are not enrolled in public health programs. Studies show that the uninsured consume about 50% less healthcare than those with insurance. Other things being equal, about one-third of the uninsured qualify for government coverage through S-chip for low-income children and Medicaid for low-income families, but they have not enrolled. Roughly one-third live in households with incomes above $50,000 and more than half of those earn $80,000 a year or more. Despite the European notion that the poor and the uninsured are turned away at the hospital admitting room door, federal law requires emergency rooms to take all comers, regardless of ability to pay. State and federal laws also require many hospitals to provide charity care, and federal and state matching funds are available to institutions that provide a disproportionate share of care to Medicaid patients and the uninsured. Through these multiple channels, the poor often have access to the most advanced technology and therapies. Many of them get their care in hospital emergency rooms, just as many Canadians and Britons do. They do not pay for the care they receive and often are not even sent a bill, just like in London or Toronto. So it can be easily seen that these 40 million do have access to insurance. They just choose not to take advantage. This is a bit like comparing an individual suffering from anorexia with the starving African. Two totally different problems, as one is choosing not to eat and the other one isn't eating due to lack of food.
Where did those ideas come from? Did they come from some benign, very wealthy person, or were they, yes, the dreams of people who saw their mothers dying in poverty, saw their wives dying in childbirth, or saw or saw others suffering grievously because they could not afford medical care. They wanted a communal system that protected everybody from illness and disease.
Health inequality has increased since the institution of the National Health Service, and in particular has widened since the vast increase in expenditure on it. So at the very least, it is not an egalitarian institution.
Wow. Health inequality has increased since there's been universal provision of the health service. I seriously doubt what you are saying. What I do know is there is health inequality within our society because of poverty, because of debt, and there is a longer life expectancy for the richer than the poorer. There are many things to be conquered in health issues, but the very principle of a health service as a right and free at the point of use is surely something that we can all be proud of.
Well, let me elucidate this for you, as I have some figures, so you will no longer need to doubt it. First, I want to show that there is inequality in the British NHS, and to do this I would like to pay your attention to page 29 of Again, the book Lives at Risk, which takes these stats from the Good Hospital Guide 2001. It's good to remember at this point that the NHS spends 20% of its annual budget on the Greater London area, although only 15% of the UK's population is living there, and this 15% has access to the most private sector services. The guide goes through 28 hospitals that exist in London, which can be seen on the map now, with the boroughs of London. It states the mortality index, the number of doctors per 100 beds that the hospital has, and also the number of nurses per 100 beds that a hospital has. With the mortality rate, the lower it is, the better it is. But clearly with the nurses and the doctors' numbers, the opposite is the desirable. Now I have preformed a simple ad hoc task to try and find out which of the boroughs are poor and which ones are rich. This has been done by simply looking at the average property values for each borough in 2001. So now I will eliminate all the boroughs that are outside the top 14, and then we can see whether the best performing hospitals are in the most affluent parts of the city or outside of these privileged surroundings. For the mortality index, out of the 14 best performing hospitals for this feature, 12 of them are located in the wealthiest boroughs. Now this could be due to outside influences. People with money have greater access to better food, for example. So now let's look at the hospitals that has the greater number of doctors. For the 14 hospitals with the greatest number of doctors, 10 of them are located in the boroughs of the bourgeoisie, and for the 14 hospitals with the greatest number of nurses, 10 of them are located in the privileged parts of London. But this is not all, as 9 of the top 14 performing hospitals are the ones that have to need with serving the smallest populations. The conclusion to this is that there is indeed inequality in the British health services, as not only does 20% of the budget go to 15% of the population with the best access to the private health sector, decreasing the 15% that need public health services, but it also goes to the wealthiest parts and less dense parts of that 15% that has an even greater access to the private services.
And that, my friends, owes its origins to those socialist thinkers in the 19th century that saw the evils of free market capitalism in Victorian Britain. Think about that. Surely there's something good in that.